Weight. Most of us struggle with it at some point in our life, and obesity is an epidemic in America. So how do we know what a healthy weight is for each of us? What are the risks associated with an unhealthy weight? What are some solutions for weight loss? And how do we speak to a healthcare professional about our options if we're struggling? Join us as we explore how to achieve and maintain a healthy weight on today's episode of CHS Presents Lifestyles at the Heart of Health. Hello, everybody. Thanks so much for joining us. I'm Jane Hansen. We have a great show for you today. We're going to talk about, weight. One of those things that we all struggle with at one point or another. We're going to cook a few healthy recipes, explore some weight loss stories, and give you some real healthy solutions. First, though, let's review the basics. More than 1/3 of U.S. adults are obese. And Catholic Health Services of Long Island is dedicated to helping us understand how to gain control of our health and the options available to do so. So joining me now to provide you with some facts is bariatric surgeon Dr. Spencer Holliver. Welcome so much. So great to have you here.
Thank you for having me.
So what is it about weight? I mean, if you Google the subject, there are millions and millions of stories out there because I think it's kind of a universal problem that a lot of people have.
Yeah, I mean, this is a problem all over the world, but especially in the United States, of people being overweight. We feel that it's multifactorial. There isn't any single cause that can really be pinpointed.
Sure, it's genetics, it's the environment, it's the way that you were raised, it's your culture. I mean, it's so many factors that get in the way of us being at a healthy weight.
Yes, economic causes too. Talk about a single parent who maybe has two children. She's working or he's working two jobs. Doesn't have the time to go shopping for food. Doesn't have proper food for good food, fruits, vegetables, good meats. Let alone the time to prepare those foods. So what do people like that unfortunately have to do is go and buy fast food, things like McDonald's, Burger King, that type of stuff.
Because that's what they can afford to do and given their time and their money. So let's talk about the idea of healthy weight. What is healthy weight? And sometimes our perceptions of what our healthy weight should be and what the reality is are different. Yes,
that's a very interesting point because a lot of people think that there's a specific weight, but you don't just look at weight. You also have to take into consideration somebody's height when you're talking about a healthy weight. For example, if you have somebody who's 6'6" and weighs 215 or 220 pounds, well, that's not really bad. But if you have somebody who's 5 feet and weighs 220 pounds, well, that's a different story. And that's where a ratio that we use in the healthcare profession that we use in order to determine who's overweight and who's not.
Are you referring to the body mass index, the BMI?
Yes, absolutely. Body mass index is a way that we use to kind of even the playing field for those people who are taller to the people who are shorter, and so you can compare evenly across the board.
So what about the idea it's diet, it's exercise? Those two things in combination with our genetics is really what helps us determine what our healthy weight is and how to get there.
Yes, absolutely. And those are the things that in order to have a lasting effect on weight and a lasting effect on weight loss, these are the things that kind of need to be approached in order. Not just one thing. Usually the things that are successful is a combination of those things.
And what we haven't talked about is really the dangers of being overweight, because if there were no dangers, it wouldn't matter how much you weighed.
Yes, absolutely.
Dangers are
things like diabetes, especially type 2 diabetes, high blood pressure, obstructive sleep apnea, things like polycystic ovary syndrome, back problems, joint problems, knee problems, hip problems. What I tell people is you take a trip, you go to the airport and you're carrying a 50-pound suitcase. You try lugging that suitcase, around even just the airport, and you feel what kind of burden it is. How about if you take 2 of those suitcases, put them on your back, and carrying them around 24 hours a day, 7 days a week? That's essentially what somebody who's 100 pounds overweight is doing.
And that's a problem.
Yeah, it's very taxing on almost every system in the body.
So when we start to talk about you as a bariatric surgeon, we're going to get into some of those options in a minute. But there is a new weight management program that's going on at St. Catherine of Sienna's Medical Center, and Dr. Deborah Blenner heads that office. She introduced us to a patient who came seeking weight loss help, and that patient says that Dr. Blenner literally saved his life. Let's take a look at this.
First time I met Dr. Blenner, I was 300 pounds, and I didn't know what to do. I read an article in the paper about a weight loss program, and my wife suggested that I follow up. I made an appointment to meet with Dr. Blenner, and she changed my life.
Here at my office in Smithtown, I do primary care, internal medicine, adolescent medicine, and I have a big focus on weight loss management. Obviously, we all know that there are increasing amounts of people that are overweight, and obesity rates are high among children, adolescents, adults, and even the elderly population are finding increasing percentages of that. So the need is desperate because they can lead to comorbidities and problems later in life. So generally there's the initial office visit, and that would be an interview with the patient and myself, kind of honing in on what are their maybe reasons for obesity, because obesity or weight problems are multifactorial. After the interview, I explained to them about the program, the components of the nutritional aspect, and seeing a personal trainer and a therapist if needed, and then all of the extensive testing and laboratory. And the laboratory is very comprehensive, a little bit more comprehensive than a regular primary care physician. And then we go on to the testing phase, which would consist of a metabolic testing. The other testing we do is a fit testing. And then at the end, the overall assessment, which takes about 20 minutes, then calculates their body age with their chronological age. And then after the testing, we also go over an EKG, and they come back and we review all of that testing, and then we make a plan specifically for them.
The key to the whole program is being able to see the doctor, a nutritionist, have a trainer so you can exercise. And it's learning. It's a learning process. Dr. Blenner was telling me I knew nothing about my medication. She helped me learn about my medications. The nutritionist, I thought I was eating healthy, and she showed me how badly my diet was and got me on the right track. And the personal trainer worked with me, got me in shape, and now I feel good. I feel good about myself, and that was my whole purpose of coming to see the doctor. I was feeling very poorly about myself at the time.
Ultimately, I like this program because, as I said, it has all the other support structures to it, and that's what really makes the success. You know, there are a lot of doctors that might do weight loss by just giving pills, but long-term weight loss and keeping it off really requires the whole program for you to make lifestyle changes, to know how to do it and to do it right. And I think by seeking my program, all those aspects are covered.
I laugh when I look at the old pictures. I have a picture on my refrigerator of my fat days. So every day I open up the refrigerator, I can look at that picture on the refrigerator, and it reminds me every day that I'm not going to go back there. I've tried to recommend it to any of my friends that are overweight. I would recommend it even if somebody's slightly overweight and they're diabetic. There's so many benefits to a program like this that even if you're not morbidly obese, that a program like this could help you out. you know, just getting you on the right track of learning about diet, learning about medication and stuff like that. That's the type of help that Dr. Blenner gives. It's more than just getting 5 minutes in the examining room. Dr. Blenner will sit down with you and explain what's going on with you, and that's, to me, was the most important part.
Wow, Robert looks great. What a wonderful story about using that kind of multifaceted approach to losing weight. But you come in when that doesn't work for somebody.
Yes, absolutely. We have, being a bariatric surgeon, we have certain criteria that in order for patients to qualify for bariatric surgery, that they have to have, and one of which is they have to show documentation that they've actually tried and failed multiple weight loss attempts.
Mm-hmm. Okay, so bariatric surgery, can you briefly describe what that is?
Sure. Bariatric surgery is a tool that we use in order to get patients to get a significant amount of weight off, and the thought is that this is not a plastic surgery type of procedure. I get time and time again people, when I tell them what I do, oh, you're a plastic surgeon, and this is absolutely not the case. In this case, we're actually doing the surgery to get the weight off to make patients more healthy.
But what is it doing though? It's gastrointestinal surgery that really will cut off their ability to eat so much and the way in which the body absorbs the food?
Well, there's 3 real different ways that you can approach in doing bariatric surgery. You can have procedures that are called restrictive procedures. For example, is the lap band and the sleeve gastrectomy. Those are procedures that will restrict how much food a patient can eat by decreasing the size of the stomach reservoir one way or another. Then there's procedures that are called malabsorptive procedures, which the Roux-en-Y gastric bypass is sort of that type of procedure in that you're actually bypassing a portion of the small intestine, so less small intestine is seeing the calories, so less calories are absorbed, hence the name malabsorption.
I got it. The thing about bariatric surgery that I'm fascinated by, is it true that if you have that surgery, you can cure diabetes and cure high blood pressure?
Yes, there are cure rates of bariatric surgery for things like diabetes and high blood pressure range anywhere from 80 to up to 95% in some studies. There's something that happens. Some of it does have to do with the weight loss. There's no question that will improve diabetes. But for the Roux-en-Y gastric bypass operation, there is something that happens when you rearrange the GI tract, and it kind of messes around with the hormones that are produced in the gut that are responsible for controlling blood sugars. And when you conduct a gastric bypass on a patient who is a diabetic, you actually see these sugars start normalizing almost immediately after the surgery.
Makes you wonder why people who might not even be obese, if they could be eligible for this, if they've got those issues too.
Yeah, that's actually something that's come up in the very recent past, and there have been studies that have shown that there are patients who may be slightly overweight but not considered obese, who are brittle diabetics, type 2 diabetics, who would definitely benefit from these types of surgeries and would cure their diabetes or at least improve it.
Well, that's fascinating. We're going to talk a lot more about bariatric surgery and speak with a nurse who actually helps coordinate it a little later on in the program. So, Dr. Oliver, thank you so much for being with us.
Thank you very much for having me.
We really appreciate it. We're going to take a quick break, but don't go anywhere, because when we come back, we're going to cook up a weight loss friendly pasta dish. Yes, I said pasta. And a delicious banana dessert. All that's coming up and more when Lifestyles returns. Welcome back to CHS Presents Lifestyles at the Heart of Health. Joining me now is Arthur Breton, the Director of Culinary Services, and Chef Peter Johnson, both from Our Lady of Consolation Nursing and Rehabilitative Center. They've got 2 great recipes for us today, so thank you so much for being with us. My favorite part, we get to cook a little bit.
Yeah, that's a good time.
What's the secret to cooking wisely if you're trying to manage your weight?
Well, I can talk from experience. One of the things you have to look at is looking at your carbohydrate intake and looking at your sugars, so on and so forth. My blood sugars have just risen lately, and I've been on a regimen of trying to eat lighter foods, less bread, less carbohydrates, and exercising more. So the recipe that we're going to be doing today is a pasta dish, but it's a whole wheat durum pasta dish with fresh vegetables and a goat yogurt. That is sauteed in a light olive oil, and then added tomatoes, and it's a beautiful dish, and it's 142 calories for a 1 cup serving.
That's amazing. Pasta at 142 calories?
Yep,
Who would have
amazing.
thunk?
I know.
You know? All right, so Peter, take it away. Tell us what you're going to do.
All right. We're going to get this nice and hot. Put about 2-3 tablespoons of oil.
Okay.
Let it get a little hot.
And this is using this wonderful whole wheat pasta, which you can pretty much find
You can
anywhere
get
these
it
days.
everywhere. Most of the stores today have that whole wheat pasta.
Now you're adding some garlic.
Yeah, about
sauteing
2
garlic.
tablespoons of chopped garlic.
Oh, I love garlic.
We're going to get that a little bit brown.
Give it some really nice flavor.
Yeah.
Now everything you kind of pre-cooked here, like the pasta is all pre-cooked. You
Pasta's
do that,
cooked
you do
and
that all
cooled.
separately ahead of time.
Yeah, and then the broccoli's been cooked and blanched. So now we're going to add the tomatoes.
Can any kind of tomatoes work in this?
Yeah, cherry tomatoes are nice, so they add a nice little flavor.
Plus they look pretty.
Exactly.
It's all about how it looks.
Of course.
It's easier when it's more appealing looking, it's easier to eat. Plus, if it's about weight management, sometimes the better it looks, the less you feel deprived of the calories.
Absolutely.
Then we'll add the broccoli.
And how much broccoli are you adding? I mean, because you can always do this in terms of how much you want to make.
Exactly. Here we have just over a pound of broccoli.
The recipe is on the, will be televised, and it's for 8 servings.
8 servings, okay. So basically 8 cups of pasta is what
That's
you're getting
correct.
out of this. Okay, so you've put in the olive oil and you've got your garlic in there, tomatoes, broccoli. Now you're adding.
A little bit of salt and pepper. I like to keep them together. It makes it a little bit easier.
So you've blended them together in there.
Yep.
That's great. Now the spices most of the time don't have calories. So spices are a great way of adding, I'm assuming, to a dish to make it taste a lot better, kind of fooling your taste buds perhaps?
Just got to watch it
Absolutely.
with the salt. You don't want to put too much salt.
Right.
Kind of defeating the purpose.
Right, exactly.
You can actually take salt out of the recipe and by increasing the herbs to give you more flavor. So if you have someone that's on a low sodium diet, you can actually omit the salt from the diet and add extra herbs, a little bit more garlic, a little bit more basil,
Sure.
whatever.
Can never have enough garlic for me. All right, so now this is cooking away. You're letting this go for a couple of minutes here. Is
Yeah.
that about it?
We're about there because everything's pre-cooked except for the tomatoes. We're just kind of warming them up. We're going to add the pasta to this.
Now, how long can you make pasta ahead of time?
About a day or two. You really don't go too long. And if you're going to do that, add a little bit of oil to it.
Okay.
So it doesn't stick together in your fridge as it cools down.
Right.
Just mix this up.
Pasta looks great. Can you make this with other kinds? I mean, it's got to be wheat pasta, but with different kinds of noodles if you want.
Of course, you could use your favorite type of noodle if you like the ziti's or the pennies.
Sure, absolutely.
We're going to add a little more salt and pepper now.
Okay,
because we added more
Because you
pasta.
just knew it didn't have enough, or
Yeah, you don't want to put too much in the beginning. Because once you add the salt, you can't take it back out.
That's true, and that would be a problem I frequently
Yeah.
have.
Then you got to take this, unfortunately, and throw the whole dish out.
Okay,
we don't want to
so
do that.
now next we're also going to add because we want to. I got to get to the second recipe
No problem.
as well.
So this is the end of that. So now that it's off, we're just going to toss the basil in.
Chopped
And we
basil.
got chopped lemons.
chopped lemons.
Yep, a little citrus to
That's
it.
interesting.
It's more of a Mediterranean type dish.
Oh,
so.
I love that. It's all great ingredients that I love.
And we're going to add the yogurt.
Now this yogurt is a little unusual.
Yes, it is. It's goat yogurt.
So is that easy to find?
Was a little difficult. You don't have it in your normal grocery stores, but I went to a gourmet store and was able to find it there. I also found sheep yogurt as well.
And then one of the things about this is when you're adding the yogurt, that takes the place of the cheese.
That's correct.
Okay, so you still get that cheesy flavor.
You're getting a protein in
This
there.
is it?
Get you a little bit. Yeah, if you want to try some.
Fantastic. Of course I want to try it. Are you kidding? That's perfect. Right there. All right. Okay, take it away with the banana while I sample this
All
because
right. In here we got about 6 bananas, and we just chopped them up,
Wait a
froze
minute.
them.
really good.
Isn't that great?
That lemon adds another nice little ting to it. This is delicious. I can't tell that my favorite Parmesan or ricotta cheese isn't in here. I love it. Okay, Ben, go ahead. Carry on.
So we got the bananas,
While I eat.
cut them and we froze them, and we took them out for about 5 minutes, let them warm up a little bit. I'm going to throw them in the blender here.
Wait, you cut the bananas up and you froze them
Yes.
ahead
Yeah.
of time?
Yes.
Yes.
Okay. Now, why do you do that?
so it's nice and cold because it's gonna be dessert. You really don't want to like warm
It's
bananas.
almost like an ice cream, so it's like replacing that ice cream that most of us crave all the time.
Right.
With a nice low-calorie, healthy dessert.
Okay.
And then here we have date honey.
Now,
It's
how do you make date honey?
It's dates, agave nectar, which is very easy to find, crystallized ginger, some lemon juice and water, and we just cook it down to a nice paste. You can make it more honey if you want, or we left it a little thick.
Now, I'm assuming that kind of thing you could actually keep in your refrigerator for some time.
Oh,
Yes.
definitely. And you can put that on chicken if you want. You know, you can do all kinds of stuff with that.
Wow.
So now we're just gonna blend this up.
I want to taste this.
Isn't it good?
That is delicious. I can see what you mean about putting that on chicken. And again, this doesn't have a lot of calories in it.
This has 78 calories for 6-ounce serving.
Oh, really?
Yeah, for the dessert itself.
Wow.
The
Okay,
the medjool dates are a little high in calories. They're like 66 calories per date. But they're a great source of fiber and
all kinds of other things that you really
Correct.
want. And I'm assuming that you don't use that many of them.
no, you do not.
Right. So, because a little goes
Just a little bit goes a long way, right.
Okay. Wow. And then how big a serving again?
A 6-ounce serving.
6 ounces.
And just blend it till it's smooth. And then we're gonna top it off with some grapes. We froze these too. If you got a nice
really?
sharp knife, it helps. And then we'll just slice them a little bit.
Sharp knives are always good.
Definitely.
And then,
Put as many as you like.
and again, giving you a little bit more sweetness, add a little fiber to it, give you more taste as you're eating this dessert.
Now, if you want something different too, you could probably put a little granola on top.
Low fat granola,
Of
right?
course.
Yes.
All right. Can I taste?
Of course you can.
Yes,
All right,
please.
because I want to see. Are you going to have some, Arthur?
I'll have some with you, sure.
Okay, good.
Absolutely.
You can have some too, Peter, because you are the chef. You're
Yeah,
the
Peter.
workhorse here. Here you go.
You take it.
Oh, all right. I'm going to try. Wow, that tastes like ice cream.
Yep.
That's fabulous. I love it. So all of the recipes are going to be on our website and at the Catholic Health Services website as well. So thank you so much.
You're very welcome.
Fantastic.
Thank you for having
What
us.
a nice treat.
Pleasure.
We're going to take another break, and when we come back, we'll talk more about weight management, give you some advice as we continue on CHS Presents Lifestyles at the Heart of Health right after this. Welcome back to CHS Presents Lifestyles at the Heart of Health. When you consider surgery as your weight loss solution, the staff at the Catholic Health Services hospitals is with you every step of the way in your journey to a new, healthier life. Joining me now is Roseanne DeLuca, the bariatric coordinator at Good Samaritan Hospital, and she's going to talk about what we can expect when this surgery becomes an option for us. Welcome. Good to have you here.
Thank you. Nice to be
You
here.
have to taste that pasta. It's so good. So let's talk about this process, because it's really about one of the most extraordinary events that could ever happen to somebody, both before and after the surgery.
Right. For the patient, just coordinating is tough. They have to see many doctors before they can even have the surgery. First, they meet their bariatric surgeon. Then they have to go to see a cardiologist, a pulmonologist, a gastroenterologist, seek out a psychiatrist, come to support groups. There are many things they have to do before they can even have a surgery date.
They go to support groups before the surgery?
Yes, we ask them to come to support groups. We use the support groups as an educational tool to teach them how to be successful, to make some behavioral changes preoperatively, and for the success postoperatively.
What's the single most important reason why they decide to have this? Is it because they can't stand the life they're living? Is it because they're really concerned about their health and the dangers of obesity? I mean, and psychologically, the stigma of being overweight?
There are so many issues that these patients have. You know, they are overweight, they're obese, morbidly obese. They have health issues. They have diabetes, they have sleep apnea, they have hypertension. Most of them can't walk a whole block. A couple of steps is an issue, walking up the stairs. Stigma, talk about stigma. Just getting into their car could be an adventure. You know, flying in an airplane, needing a seatbelt extender, going to the movies, you know, those seats are tight, going out to dinner, you know, or even just having a social event that they have to go through. They have to get dressed. Most times they want to say, no, I don't want to go. They're embarrassed of their size. They feel if they walk in the door, people will look at what they look like, not who they are.
One of the things that Dr. Oliver said was that the surgery may actually cure high blood pressure and diabetes. That in and of itself has got to bring something to these patients that they must almost be in disbelief.
Most of our patients come to us and you can't imagine how many medications that they're on. It floors us just to hear how much insulin somebody's on, and then the minute that they have the surgery, they're off almost all of their medications. And then we monitor them.
That's amazing.
We monitor their blood glucose, we monitor their blood pressure to make sure that they can stay off of their medications.
What's the most profound or significant or heart-rendering thing that a patient has said to you after the surgery?
There are so many people that say so many things, but I love it when people say, you know, now I can get on the floor and play with my grandchildren. I can go to a restaurant, people aren't looking at me. I have patients who are dating now, people who are going for jobs and getting jobs. They've been shunned before.
I want to invite everybody back in that we've had on the program, Chef Peter, Arthur, and of course Dr. Oliver. Please come back in as we wrap this up because, of course, I want to say thank you to all of you. And I think we're going to taste the pasta, Roseanne.
We are.
Thank you for being here with us. I just want one last thing for you, Dr. Oliver.
Sure.
I want to ask you the same question I asked Roseanne. The single most heart-rendering thing a patient has said to you after the surgery and after they've now achieved this unbelievable weight loss?
Well, I have to be honest, there have been so many wonderful things that I've heard from my patients about saving their lives and changing their lives. But probably the one of the single best things that I ever heard is we have a number of patients who weren't able to get pregnant before the surgery. They didn't have regular periods. They tried for years and years. They were overweight. Then all of a sudden we do the bariatric surgery. They lose 40, 50, 60, 70 pounds, and all of a sudden they not only can get pregnant, but they do get pregnant. Wow. So they consider it to be, almost like a miracle that you're giving them, a baby that they weren't able to get before. Yeah, that's probably the single most moving thing.
That just sent chills up and down my body. On that note,
incredible.
You get to have some pasta.
Thank you. Yeah.
Thank you all for being here. I
you.
really appreciate the information and the advice and what you've shared with us today. So thank you very, very much for all the great work that you do.
Thank you.
And as always, for more information or to schedule an appointment at one of Catholic Health Services' 6 outstanding hospitals, you can call 1-855-CHS-4500 or visit chsli.org. Thank you so much for joining us today. I'm Jane Hansen, wishing you goodbye and good health.